if you have gone to your doctor or your pharmacist recently, your details will have gone through one of our computer systems at some stage. Our footprint in Ireland it stretches out to nearly 8 out of 10 clinicians at the primary care coalface. So that's your primary care, your GP, your nursing home, your pharmacy. If the service provision model is wrong, your product could be the best in the world, but people will move on. So I think the real uniqueness is in the people that we employ and also in their dedication to the customer. Many of the people here are here over a decade and have lots of tacit knowledge and customer knowledge, and that is really what's unique about Helix Health. Our very genesis was, writing computer systems back in the early days, back in the late 80s and early 90s, which effectively, it either printed something or it printed a label, and gradually the sophistication over the years has grown. What we're working on at the moment is electronic links, and the whole company strategy is about joined up healthcare. So whilst we have systems with GPs and systems with pharmacies and systems in care homes, as isolated little reservoirs of information, that's useful, but not as useful as if you can get this all joined up and you can get the GP systems talking to the pharmacy systems and talking to care homes and so on. So that's the next layer of innovation for us, is electronic referrals to hospitals, and it's all about improving the patient journey. So as a patient within the healthcare system, as you're hitting your primary care, your continuing care and into secondary care, it's making life easier, and that's what that technology facilitates. I think in particular this award is special, and it's special because it really validates the work of the people. Whilst you might get software awards and you can be accoladed for pure financial performance, this is one that really people can connect with, and they can see that their hard work and their work with the customers, this is validated in this award more so than the quality of our intellectual property or the type of technology platform we're using. Where we are in terms of growth, the company hasn't stopped growing in 20 odd years that it would date back. We've never stopped innovating, we've never stopped researching. We've established a very good strategic presence in many hospitals across the United Kingdom, many centres of healthcare, health screening across the UK, and also in online pharmacy, which would be new. It's not in Ireland yet. We've used the platform of all of that learning to allow us exploit other markets, and with the support of Enterprise Ireland, we have moved into markets in the Middle East. We have some active pilots going on, paid pilots in 1 or 2 countries down there, and we're actively involved in bids. I believe our next phase of growth is in the international space, most definitely. It's about the commitment of the people, how long they've stayed with the business, about their knowledge, and more importantly about the service provision model. In terms of the company, the way the company is balanced, unlike other technology companies, it's not mostly in development or mostly in sales. The actual largest department within the company is at the service provision. It's the customer support and customer services department. And I think the company particularly excels in this area, and service is just very close to our heart.